So thanks for being here. Motherhood. What? Okay, we're going. Yeah. All right. Thanks for being here. So motherhood is really an exciting time, or that's how it's portrayed at least, right? Realistically, though, it can be a very difficult transition. Fortunately, though, many individuals, especially high-profile celebrities such as Chrissy Teigen, Serena Williams, and even Tracy Ellis Ross during an episode of Blackish, are talking about the complications of motherhood to include high-risk pregnancies, postpartum depression, and the stigma that's attached to mental health. Today, we're going to be bringing a lot of these maternal mental health topics to the surface. We want to hear your comments, your hard questions, and the innovative ideas that you have so that we can work together to support women through their transition into motherhood. We're going to start by hearing from Dr. Jodie Horton. Dr. Horton has been a practicing OB/GYN for 16 years. She's spent most of her career serving vulnerable and marginalized hospital patients in Washington, D.C. and Virginia. Dr. Horton will talk from the physician's perspective and highlight the distrust and lack of diversity in healthcare systems. And then we'll hear from Teanna Diggs, a doula, licensed clinical social worker, military veteran, and mother of 4 children under the age of 7. Teanna provides psychotherapy to pregnant and new moms at Postpartum Wellness, and she's also the director of trainings and scholarships at Postpartum Wellness Foundation, where she develops and manages training opportunities for students, healthcare providers, and mental health clinicians. Next, we'll talk about intimacy and sexual health during pregnancy and after bringing baby home. Valon Alford is a licensed clinical social worker, sex therapist, and sexuality educator. In addition to providing mental health services to the NFL Player Care Foundation and consulting with the psychiatry department at the University of North Carolina School of Medicine, she has her own company, Vitality Wellness Solutions, where she focuses on mental and sexual health and wellness. I'm Rosalie Zuniga. I'm the moderator for the panel. I'm the founder of Postpartum Wellness Foundation, a nonprofit organization in the Washington, D.C. area that focuses on closing the gaps between physical care and maternal mental health care through out-of-the-box initiatives. Our speakers have asked that you post your comments and questions in the chat box, where I'll turn to after the 3 panelists have provided their perspectives. We're so excited to have a lively discussion. So Dr. Horton, let's go ahead and get started.
All right. Hi, I'm Dr. Jodie Horton, and I'm going to talk to you about the perspective from the physician side, but also kind of give advice from the patient's side. I have been on both sides of the coin, so I kind of know or seen both approaches. And so I think it's important to know that knowledge is the key to better health, and it's essential for you to be your own advocate. And I think the most important way to do that is through collaborative care with your physician, but also keeping open communication with your physician, your provider, whether it's midwife or an OB/GYN, also your nurses, your social worker, your therapist. There is a lot of obstacles in prenatal care, and even before you become pregnant. And so you want to recognize what those problems or issues are, and make sure that they're all addressed, ideally before you get pregnant. And the more knowledge you have, the more you're going to be able to empower yourself, ask a question or questions to your provider, and understand your medical condition. And unfortunately with pregnancy, that can be an ongoing thing throughout the pregnancy and afterwards, because things change before you get pregnant, how you get pregnant, when you become pregnant. We see you every 4 weeks and every 2 weeks and 1 week, and things can happen rapidly during your pregnancy, during birth, as well as postpartum. So as many of you may know, that Black women are 3 times more likely to die from pregnancy-related complications than white women. And in fact, if you're over the age of 30, you're 5 times more likely to die. The data, there's been very little data, but what they've concluded so far is that they don't know why, but we do know that systemic racism exists in the medical community. And it's really something that hasn't been appropriately addressed. But I'm going to tell you some things, basically what to do as a patient. The first thing is to find a doctor that you trust. If you find a doctor, ask as many questions as you need to. If that doctor is not comfortable with asking those questions or blows you off, then you need to find a new doctor. And when I say doctor, I apologize. I'm so used to saying doctor, but a provider. So if you're a midwife, a nurse, whoever is taking care of your birthing process. So yeah, make sure that you're comfortable with this physician because you will be with them during the next 10 months and afterwards. As providers, we need to also check our biases. We all have them. And I think we need to do a better job of training to find out what those biases are and how it affects how we take care of patients, because it does affect outcomes. Many women, so 57% of Black women have hypertensive disease, which then can translate into very serious conditions like preeclampsia. And you've heard of recently the pediatric chief resident who had passed away from preeclampsia. And although we don't know that the whole story or seen her charge or reviewed it, it's still very concerning, because what they found was despite socioeconomic status, despite education, maternal death is still happening and nothing has really changed. So even though we're aware of this, it's like, what are we doing as a hospital, as providers? What are we doing to make this better? And so far, I would say we're lacking in that area. Black women are also at increased risk for preeclampsia. We are at risk for preterm birth. So 1 in 6 will have preterm birth. 2/3 of neonatal deaths are due to prematurity. So as a result of that preterm delivery, many times when you become pregnant and you're identified as being high risk, you will work in conjunction with maternal fetal medicine, a cardiologist, whatever your medical conditions are. It is so important for you to understand what is going on, because that increases your compliance. So you know why, you may have more than one visit every 4 weeks. You may have a visit every week for the entire pregnancy. And it's not to inconvenience you, but it's to monitor you. And if you understand why, then I think that would increase compliance as well, as far as showing up for your visits. And knowing any signs or symptoms of something that puts you or your baby at risk. Ideally, my recommendation for people who, when they do become pregnant, is to be in their most optimal health. So if that means, achieving your ideal body weight, if you have blood pressure issues, making sure that you're on medicines that are appropriate for pregnancy before you even get pregnant, getting your blood pressures under control, getting diabetes under control, your asthma, but also if you have mental health issues. So if you have anxiety, fear, a previous traumatic birth, make sure that you have a good support system. So make sure that you're tapped in with a therapist, a social worker, a faith leader, somebody who can help you navigate through pregnancy. It is definitely a joyous occasion, but it's also a very stressful situation, because again, throughout pregnancy, you may learn one thing and then the next week something may change. And if you're like me, I don't like change, and it can be very stressful. And so having someone, having that support system in place definitely will help you kind of cope better, because stress, obviously, we know affects our physical health as well. And then the other thing, know your resources. So when you talk to your doctor, make sure the biggest thing is like communicating. So I was just reading another article where a patient said, she was experiencing postpartum depression, but she had never told her doctor. And so make sure that you're open and honest. We've heard everything. Don't be embarrassed. We may have experienced the same thing. And that's where that stigma comes in. So people don't openly talk about it. So I'll share, like, I, as an OBGYN, had postpartum depression, didn't even recognize it until much, much later, which is crazy because it's what I do. We don't do a very good job at screening people as well. So as physicians and providers, we need to do better about asking those questions, but also as a patient, it always helps us the more information you give us so that we can provide resources for you. So that's what I love about the Postpartum Wellness Foundation, and why I joined was because 1 in 3 women experience postpartum depression. But if you don't have insurance that covers therapy or just therapy in general, people may not be willing to go because it can be out of pocket. I paid out of pocket. I had insurance, but I paid out of pocket, and it can be expensive. But someone like Postpartum Wellness Foundation will give you those resources. And so I'm excited about bringing that here at my hospital, because we definitely have the need. Again, we screen people for anxiety, fear, depression, trauma, intimate partner violence, but we do a really poor job afterwards once we identify those patients. And I think that's where we're failing a lot of people. And then also once you deliver. So we also do a really bad job of that. And that is another area that we need to improve on, once you deliver, you're there for 2 or 3 days, and then we send you home with a brand new human, and we're like, good luck. If you have a high-risk pregnancy, we may see you 1 week after, and then at 6 weeks. That's a lot of time. All of that can be overwhelming. You go through all these body changes, you go through these hormonal changes, emotional changes, plus the stressors of life. We definitely need to follow up a whole lot better. So my takeaway is really make sure you get a doctor that you trust, that you feel comfortable and can be honest with. Expect more from your doctors. Make sure that you understand your diagnosis. Ask questions. Sometimes we talk in our doctor speak and forget who that we're speaking to. And so if you don't understand, always question, say, I don't understand. And that provider, physician should be okay with explaining it to you again. I draw pictures. I break it down. I give scenarios, whatever it takes. But there's nothing worse than leaving and the patient says, I have no idea what they were talking about. Then I feel like I failed you. So if you have questions, never feel bad or embarrassed that you don't understand, because that's normal. When I go to take my car, I don't understand what they were telling me. I ask questions. So definitely do that. And the other thing is, get that knowledge. So when you do have that diagnosis, you can Google it. Even though it frustrates doctors, Google it, find out as much information, and then come back and ask more questions, because that's the way you're going to empower yourself, understand the whatever condition you have or problem you may have during pregnancy, so that you guys can continually work on having a healthy pregnancy, healthy delivery. And then just take care of yourself. You're going to be your biggest advocate.
Thanks, Dr. Horton. Such great advice. And also we really appreciate your vulnerability and authenticity as well. Thank you. Valon, let's move on to intimacy and sexual health.
Thank you. So I'm really excited to be here. And I wanted to spend some time talking about sexual health during pregnancy and the postpartum period. The irony is that once you get pregnant, we tend to do away with the whole notion of sex. It served its function to reproduce. You've successfully conceived a baby, and then that becomes the focus for the next 40 weeks. And then when we do talk about sex, it's literally about sexual intercourse or sex acts. People want to know if it's safe during pregnancy. In general, it is. How do you make it work during pregnancy and things of that nature? But that's really just one piece of it. What we don't talk about or really give light to is sexual health and sexuality. So sexual health refers to physical, emotional, mental, and social well-being in relation to sexuality, which is really a central part of what makes us human throughout the lifespan. It includes things like our sex, our gender identities and roles, sexual orientation, pleasure, intimacy, and reproduction. And it's experienced and expressed in how we think, our fantasies, our beliefs, our desires, our attitudes, and it shows up in our relationships and also during pregnancy. And what I want to do is really to reframe how do we center and prioritize sexual wellness during that time, during pregnancy and the postpartum period. And as Jodie mentioned, excuse me, Dr. Horton, I'm like, oh, wait a minute. But this is a period that is marked by an incredible amount of changes already that influences a woman's own sexuality as well as her relationship with a partner. In general, sex as an act is okay during pregnancy. It can help to improve your sleep, improve your mood, can also help to build and maintain intimacy in your relationship. However, you should consult your provider and abstain if recommended. For instance, if you are having a high-risk pregnancy or experiencing certain chronic health conditions. And what I usually tell people is to explore different types of sex during pregnancy. So there is more than penetrative vaginal intercourse. You can try mutual masturbation, anal sex, and oral sex, and you can also switch up positions. So missionary sex doesn't tend to work as well during pregnancy for a lot of reasons, but sometimes spooning is helpful. Having the pregnant partner be on all fours or having your partner enter you from behind can be more helpful in alleviating pressure on your back. But what I also want to highlight is just that the rates of sexual dysfunction during pregnancy and the postpartum period are pretty high. This is pretty common during pregnancy and the postpartum period. And when I say sexual dysfunction clinically, what that means is that a person is experiencing difficulty in their ability to respond sexually or to experience pleasure. A lot of women are feeling very self-conscious. You got leaky nipples, stretch marks. We're breastfeeding. We're adjusting to new roles. And so these things can really make us feel a certain kind of way about our bodies. And so the amount of sex that people are having during pregnancy obviously also tends to decline. And some factors are, like I mentioned, just the changes in the body. And oftentimes people are feeling like they're less attractive and may also lose interest in actually participating in sex acts altogether. One thing that is fairly common as well is also painful sex. So we aren't really talking about that in the open, but it comes up all the time, and especially in the postpartum period, depending on things like birth trauma and how a woman may be adjusting to parenthood. So the quick fix, you hear a lot of people talking about Kegels and how helpful they are, and they can be helpful to strengthen the pelvic floor. But as Dr. Horton mentioned, it's really important to share these changes that are happening to you and your body throughout pregnancy with your provider, because there are helpful resources and recommendations that can be made, for instance, with pain during intercourse, you may be referred to a pelvic floor physical therapist, and they can help with things like addressing that pain or incontinence or hemorrhoids, things that we don't really talk about when we romanticize pregnancy. And so I just like to highlight that sexual health is really a quality of life issue, especially during pregnancy and the postpartum period, because there's just so many different things going on that can affect your physical health, your self-esteem, your relationship dynamics, your mood, and actually how you parent. Postpartum mood disorders, mood and anxiety disorders. We use an umbrella term, postpartum depression, but there are a lot of different mental health conditions that a pregnant and or postpartum woman may experience. And that is actually the number one complication of childbirth. And so those conditions in and of themselves may affect your sex drive. And then the treatment. So we say, oh, well, if you're experiencing these issues, connect with a therapist, talk to your doctor, talk to a sex therapist. But in all actuality, especially if you're using medication management as an option for treatment, some medications also affect your sex drive. And I just like to highlight the intersectional experiences of Black women. So we're navigating during pregnancy and the postpartum period a multitude of changes, just in general, right? But then you marinate that pregnancy in the Black maternal mortality rates that are 2 to 3 times that of white women. And then we bake that in a global pandemic, which further strains access to quality health care, switches up birthing plans, and makes the situation ripe for traumatic birth. And then we garnish that with a little racial trauma related to things like, to facts like Black men are 3.5 times more likely to be killed by law enforcement. 1 in every 1,000 Black men will be killed by a police officer. So we are experiencing pregnancy while also, whether we're actively or subconsciously thinking about it, we're thinking about life and death at the same time, all the time. And so the title for today, From Surviving to Thriving, is so important, especially with sexual health during pregnancy, because we are literally, trying to survive and thrive while thinking about and balancing the mortality of ourselves, that of our Black partners, Black sons, Black children, and all of these different things. So as women of color, we do have a very unique experience during pregnancy. And so back to that original question of how do we actually center and prioritize sexual wellness during this time, I think the short answer, and what I give to a lot of people, is that we want to focus on intimacy and vulnerability and communication, right? So radical acceptance is something that I offer to people, and just accepting that this time period is full of change. It's the one thing that's predictable throughout pregnancy and the postpartum period. And also that dysfunction is pretty common. When I say radical acceptance, I'm not saying that we should accept dysfunction, but I'm saying if we can accept those notions as true, I think it alleviates a lot of frustration that people feel. This must just be me and my pregnancy. Oh, how is my partner feeling about the way that I'm feeling? Like I should go ahead and have uncomfortable or painful sex because I don't want my partner to go without, and then that cause additional issues. So I think that radical acceptance can just be a good landing place for us to just begin there, but also taking that focus off of sexual acts. It's okay if you don't want to have sex, or if your sex drive has diminished, and really just prioritizing your health in general, your mental health, your physical health, your sexual health. So doing things like saying no and seeing a therapist, telling your doctor how you really feel, I think those can be really helpful. And then also offering yourself compassion with all of the changes that are happening. As women and mothers, we tend to be very nurturing, but we usually externalize that. And then we say, oh, we get the indirect benefits because we're so good to other people. And as women of color, it's often the last thing that we do is to prioritize ourselves. And like I said, even during pregnancy, most women are probably seeing providers more frequently than any other time, but it's really that focus on the physiological and the physiological changes in the medical treatment as it pertains to the woman who is carrying the baby, not necessarily the full person. So, process and unpack and don't internalize all of those changes, because there are valid biological and psychological, physiological changes that are impacting your emotional well-being and your general health. And all of that is a part of your sexual health. So those are a few nuggets, but I also want to stress to women to keep your partner involved in your pregnancy. That's a great way, back to that vulnerability, communication, and intimacy. I know that we can be really great at hitting up a group chat or a Facebook group, intellectualizing or reading a book or reading all the books and WebMDs. And the main person who we're interacting with all the time in the house, that's our parenting partner, our life partner, we haven't necessarily included that person in the process. So share these feelings and these changes, even your insecurities, because it's usually an elephant in the room and you all are sort of dancing around these dynamics. So I encourage you to just share with your partner, hey, I think you probably noticed I haven't been really wanting to, have sex lately. And, that makes me feel uncomfortable. I'm worried about how you're feeling, but I'm just not with it right now. But I think really owning that and sharing that is really important. And then also talking to your providers, like Dr. Horton mentioned, not always brought up. So we feel awkward. Our providers are not bringing it up. Even as a therapist, I can remember a time where I wasn't always bringing it up, and even working with or specializing in working with pregnant women and women who have recently delivered, I don't always explicitly ask about sexual health, but there are key things like when we do an Edinburgh assessment, or you may have taken that at a prenatal appointment, and it just kind of checks into symptoms of depression and anxiety during your pregnancy. It may be 4 sessions in where, I've been working with a woman who is experiencing a lot of anxiety and depression. And then it comes out that, one way that that's expressed, or one way that she experiences that, is in her relationship with her partner and the fact that they haven't had sex in months. And usually, these things it's multiple things that sort of rolled into one. But I think the main thing is just that we don't have to be super women and suffer through the changes and things like pain. You can have a great pregnancy and a vibrant sex life that really encompasses sexual health and the fullness of it, and not necessarily sex as an act. So that's what I would like to share on sexual health and pregnancy.
We can't. Can you hear?
I've seen him laughing.
You're on mute.
Mm-hmm.
Can't hear you.
Mm-mm.
No. Should we keep talking?
Yeah, we can. Well, like pregnancy is unpredictable.
And I wanted to just go back to, also, I forgot to mention that about, the postpartum period. A majority of maternal deaths occur in that postpartum period. And so, again, we need to do a better job of following up with our patients during that time. Things don't just end after you give birth. You're still at risk for complications due to pregnancy during that postpartum period. So, and the other thing I want to throw in there is, like, if you have a lot of stress, anxiety, fear about delivering, it's always good to create it like a birth plan, work with a doula, and then work with your provider so that it can alleviate some of the fears, and things like taking a tour of labor and delivery or taking a birth class, those type of things will help kind of, if you're a planner, to kind of help you navigate. But again, be flexible because things change all the time.
Can you hear me?
Yes.
Can you guys hear me?
Yes.
All right. No idea what's going on, but it's all good, right? And this is the perfect reason why I think I'm going to be talking about when it comes to closing this all and wrapping up. The idea of being able to really just say, let me look at my life, let me look at things that are going on in my life, and then really being able to focus on what's really important, what our priorities are, right? Are you still able to hear me? Am I going in and out with you?
A little bit. It's like delayed.
Mm-hmm.
Can you guys hear me now?
Yes. No.
Okay. So I really want to talk about the importance of self, the importance of being able to really look at ourselves in the mirror and ask ourselves, who are we? What are the things that feel like we're lacking, right? And what are things that we feel like we need to change in our lives to make ourselves feel more fulfilled?
Where did she go?
I think we're having some technical difficulties, but Teanna, and hopefully she'll be able to rejoin us, but she was going to highlight just the mental health aspects of pregnancy and the postpartum period. In general, we consider the postpartum period the fourth trimester, depending on who you talk to, all the way up to that first year after delivery. And from a mental health standpoint, I know Teanna has a certain vantage point as a mom of four and also as a doula. But with mental health, a lot of women are experiencing anxiety about things like the pandemic, about delivery and the mode of delivery. About financial strain and how that may impact a family and family dynamics, about virtual schooling, and preparing their children. If you are in child number 3 or 4 and you have a spread, managing the needs of all of your children, plus your own personal health. And then if you are a working mom, just sort of all of those layers of the onion of our intersectional experiences. And those things may make us feel, like I said, anxious or depressed. There are clinical thresholds, but there is postpartum anxiety, postpartum depression. There is bipolar depression that may affect pregnancy, and there is psychosis. A lot of women are chronically experience suicidal ideation during pregnancy and during the postpartum period, and that can be a really scary thing. Sometimes people may have a plan, and that's what we call an acute situation. So if someone is experiencing a mental health situation where they're having these thoughts of harming themselves, then we would always encourage immediate help, or calling 911, or going to your nearest emergency room. But there's a sort of, are you all connected?
Can you hear me?
Yep, I can.
Yes.
Okay.
All right. So you said a lot of the things that we were trying to say. We are actually in the same space, so we're wondering if maybe it's the internet connection here. But one of the things I do want to leave you guys with, as Valon said, I am a doula. I am a mother of 4. All of my children are 7 and under. And I also spent 14 years in the military. And I really want to ramp on that when I talk about women of color and our mental health. I've been to the front lines of war zones, and I know what PTSD looks like. I know what anxiety looks like. I've seen it firsthand. And it's a very, very, very strong resemblance to what we as Black women go through after we have a child. We deal with post-traumatic stress. And that comes from so many more places than just the birthing experience, because that alone, working in a system that was not made for us, was not made for our success when it comes to birthing a child, is already too much stress, right? How to navigate the healthcare system. As Jodie was saying, the providers they don't learn about how to deal with Black women as they give birth. They don't learn about the cultural differences. They don't learn about the emotional stress. They don't learn about the things that we already hold on us before we even conceive for the first time. And I see that during the delivery. I see women of color feeling like they're being pushed into positions that they didn't want. I'm being seen that they're having all of these microaggressions thrown onto them, and they don't know how to take care of it. They don't know what to do because the education is not there, right? Not because we're unintelligent. We are extremely intelligent, but we only know what we know, right? Mm-hmm. The system itself is pushing us to the side and saying, well, you just deal with this part, right? Even something as simple as our pain that we go through, our pain threshold. Who are you to tell me what my pain level is, right? And to feel like, oh, I just have to be okay with whatever they gave me. And then we go home, right? And let's be real, community village doesn't look like it looked generations ago, right? Why? Because we move away, right? We move away, we go to school. Our communities have changed. Our villages look different. And if we can't find that village of people who can really be there to support us, we feel alone, even when it comes to the motherhood, to the motherhood journey as a whole. Right now, I have my 4 little ones. It's a pandemic and my husband's deployed. I have to make sure that my village looks strong because I don't have family that's around here. So what does my village look like? First and foremost, my village has to start from within. I have to be able to look myself in the mirror and say, who am I and who do I want to be? And how do I look at myself and say that I am strong, right? And if we don't feel that way, if you don't feel that strength, then how do I raise my hand and say, I need the help? So many times I've had people come onto the virtual platform recently and say, it's a breath of fresh air to know that you are a Black therapist, because I have gone to therapy before and I've stopped because they don't understand the basics of what I was trying to explain to them. Because if people don't understand who we are fundamentally, how can you really truly help us? And that is what a lot of what I'm hearing when it comes to our community. It's not that we have a huge stigma to mental health, although the stigma is there, but rather it's who do we find people that we can trust who understand us on that basic level? Because before I can trust you and tell you how stressed I am, you have to understand what stress looks like to me. And stress looks like to me very differently because I see things differently. I'm feeling things differently. So for us to really understand that, we have to first be able to say, I see you as a woman of color, not because it's just simply a color thing, but because there's more to it, whether or not people want to say that or not, right? We like to say so much, oh, it's not about color. Unfortunately, society has made it that way, right? So in order for women of color to feel strengthened and empowered through therapy, we really, really need to be able to allow them to feel comfortable in that space of being able to say, I am first and foremost a Black woman. Now let me tell you what I'm struggling with. And that is what we at Postpartum Wellness Foundation are striving to do, striving to teach our people to be able to encourage and inspire and empower, right? And then also be able to teach our healthcare clinicians, from our future social workers to our future physicians, that, hey, you have to understand what society looks like. And society includes the racial inequalities, and you have to be able to understand them on so many different levels so that we can truly thrive in this great community, if that's what we're going to try to pull within us. So it is not about the stigma of mental health. It is about being able to find people who fundamentally understand who you are. Because although the color of our skin is a pigmentation and not a representation, it is fundamentally who we are when we're trying to get the help that we need. So that is what I wanted to say. Sorry for all of the technical difficulties, but I think we do have some time for some questions.
Yeah, are there any?
I'm so glad that you were able to get back on, because I mean, you just really hit it home. Like,
yeah. And it's so funny because I literally just had a patient that was, contracting. We thought she was in preterm labor. She ended up being stable. We went to keep her overnight. And then she was like, I have 3 girls. They're about to start school. I need to go home and do their hair. And it was funny because the white physician, the maternal fetal medicine doctor, she was like, I mean, you just comb a girl's hair. And I was like, no. That's an all day thing. I was like, she's stable. She knows the signs and symptoms. I felt comfortable. I was like, no, she's got to go home. She's got to get her girl's hair right.
I'm telling you, I have 4 girls. I'm telling you, 7. I got to think about the ages: 7, 5, 2, and 10 months. One of which she's got me ready to be. She's ready to nurse. I can feel it. But it's important to really understand like all of that, right? Instead of just saying, oh, this person doesn't feel stable to me. We gotta, in a sense, put her away. We got to take her to this place. Really being able to really look at, let me see what that's really going to look like. And is this really going to help her fundamentally at the end of it? Because yes, you can send someone, to if they really need it, they truly need it. You can send someone somewhere and they can really get the help. But if it's going to cost much more than what it's going to be helping, then we have to be able to balance that as clinicians.
Mm-hmm. Right. I see there's a question about how are you able to find Black physicians and doulas? I think doulas have a website, correct? Black doulas, Black physicians. I think there is the website. I'm not sure. I can get back to you on that. A lot of people ask me, like, because I don't see people for prenatal care. I provide just, care for labor and delivery. But word of mouth is the best way, because that's how I find my physicians. I may know physicians who, like, I had my foot operated on. I know physicians who operate on feet. However, I want to know, like, who's good.
Mm-hmm. Right.
Care of me, who's going to do a good job. If I have complications, are they going to follow up? Because there's a lot of physicians out there. Not all of them are good. None of them, all of them are honest or do the right thing. And so word of mouth is going to be our best thing. But I can find that list.
And I see a question about How much does racism impact pregnancy, birthing, and post-delivery for Black mothers? I feel like it may not be as much, racism definitely plays a part, but I feel like it's also the inclusion, right? Because as a woman of color, if you're saying that you want to have a natural birth, but all the birthing centers in your area have only white midwives and white doulas, will you really truly feel like you're a part of that community when you're doing that birthing process, right? So you're going to try to go somewhere else. So I feel like in order for us to be able to squash the negative annotations when it comes to Blacks and pregnancy, we have to be able to have more inclusion. We have to be able to put more people of color in these natural places, right? Lactation consulting, doulas, midwives, birthing center as a whole. In the DC area, you know, they have these amazing birthing centers right in the Black communities, but they're not truly for us, right? Because when you walk through those doors, you don't see people that look like you. So what's the first thing you do is you're like, I'm going to turn around because maybe it's not meant for me to have a natural birth. Maybe it's not meant for me to breastfeed because I can't find people who can understand the things that I'm going through. Someone who I can really connect with because they look like me and they're understanding the struggles that I'm going through. It's not that I don't want to breastfeed, but how am I going to pump when I'm working a 9 to 5 and I don't have a pumping room and my boss is not listening when I say I need that space? So really being able to really work with people that look like you, who can find the resources, I think that is the biggest thing when it comes to being able to open up that door so it doesn't feel like we're kind of closed out of our own experience as mothers.
And to go back to that, like I see racism all the time. Teanna, you had touched on that. Like there was a recent 2016 study where they surveyed medical students and residents on whether Black women feel pain differently from white women. And a majority of them actually thought we were biologically different. And we see it all the time. I call doctors out, like, you know, this patient, why can't this patient get, you know, an epidural when they request it? You know, they move differently, or even during a C-section, you know, stop and be like, this patient's pain is not well controlled, and they'll kind of dismiss it. I'm like, I'm not proceeding until you get this, you know, pain under control. You see it in the ER. You see it in the ER a lot. Not only race, but socioeconomic status. And people are unaware because they have no idea what's happening. But I see it all the time, unfortunately.
From the mental health side, I see racism with that sort of reinforces this stigma of, you know, if I say that sometimes I wish I wasn't a parent, or sometimes I wish my kids weren't here, I don't know if I always want to be here, I'm depressed most days, will they come and take my kids, you know? And I see this quite often. And I, as, you know, part of interdisciplinary teams, I'm having conversations like, if your client has disclosed this to you, it is a good thing, right? Like, let's get away from should we be calling CPS, like, and not saying that you shouldn't, if there is, you know, if you suspect harm, but, you know, those implicit biases that come into play as providers and sort of gatekeepers, like, well, you know, this is where my barometer is no, it's meeting this woman who is talking about her experiences. And again, I always just highlight the fact that we are in the middle of a pandemic, no matter if we're a few months out or a few months in, and these intersectional experiences, as Teanna mentioned, for women of color. So there are multiple layers to this onion, and it is very nuanced. But when we're creating space for people to unpack, it shouldn't always be, well, you know, do we need to be calling in CPS? It should be a supportive space where we can help mom problem solve and really address her own mental health. And for me, if it's coming out in therapy, I feel like that's a win for everyone.
And to go back to Elise, you asked about, you know, how our hospitals supporting pregnant Black mothers that work there. I delivered where I did my residency. And it's actually funny now that you mentioned that. I was like, oh, they take good care of us. But actually, after I delivered, no one took my vitals until I left. because they just assumed, they're like, oh, you'll say something until, if everything's fine. I wasn't a high risk pregnant in the sense that I didn't have high blood pressure or diabetes or anything like that. But they were like, she knows what she's doing. She'll let us know if something's going on. So it's interesting. But I remember I also recently read something on Instagram where they were talking about someone had come in, or even like when I took my parents to my doctor or their doctor appointments, I mentioned I'm a physician. It's not something that I normally, I don't introduce myself as that. It is a job. It's not my life. But I notice things change when that happens. The care gets different. The explanations, the time gets different. And so it's really sad that you have to do that. But it's the reality. It absolutely is the reality.
Yeah. And Imani, I'm sorry that happened to you. I see your comment about being Black and vegan and your daughter had to have her blood checked. And you were told that she was contacted if she didn't. I have a close friend whose child, he had I forgot what you call it, APIs. It's a nutritional sort of an allergy. It's a rare allergy that he has, but for the differential diagnosis, she lives in the DC metro area. For her differential diagnosis, it started from maybe a seizure disorder to all of these things. But by the time she left a local DC hospital, there were talks about, contacting CPS related to developmental delays and things of that nature. And I think this is real because it affects how we interact with systems. And like I said, that impacts our sexual health, our stress, our mental health, the care that we seek or don't seek. So it's really important because these things do come up and they do come into play. And so it's unfortunate, but I think having Black providers, knowing that we are out there, and then also the truth is Black providers and like us for clinical social workers, Dr. Horton being a medical professional, we're a small number. So depending on where you live and where you're located, it may not be likely that you can access a Black provider, but I will say interview your providers, right? Like you can, just like you have autonomy in terms of the health advocacy in your experience. So you can, when you, I Google people, or, if you're going through your insurance, they have directories, right? So most of them, you can select gender. You may not select race, but a lot of them will have pictures and directories. And I always encourage people to just call, explore their website. What does their page say? And then just say, hey, I found your page. I'm a woman of color and this is my situation. Is this something you have experience in doing? Do you have experience working with people with issues like mine? And really, and you don't have to be committed to the provider that you get with. It really is relationship based. So try them out, like a pair of jeans, see how they fit. I always tell people give it at least two sessions, right? Because the first one, traffic could be a bad day. But if the vibe isn't there, guess what? You can find a new doctor. You can find a new therapist. And sometimes that may be easier said than done, but I just want to reinforce that you do have options. We do have choice. We do get to say what happens to us and who has access to us, because that trust, going back to Dr. Horton, what Dr. Horton and Teanna said, the more that you trust your providers, the more that you feel like you're understood as a client, as a patient, as a person, the better those relationships are. And the better those relationships are, the better quality of care you'll get, and the better you'll feel about your pregnancy and that postpartum period.
And to answer Jennifer's question, and kind of what Valon said, you absolutely have patient autonomy. If you don't feel comfortable, getting the flu vaccine, that is absolutely your right. All we can do as providers is give you that information, and then it is your decision as to what you want to do. Don't ever let anyone force you into a situation that you don't feel comfortable with. You can always say, I'm going to take this information, think about it, come back. That is absolutely your right to do. So don't forget that. That's like huge. People think because my doctor told me or my provider told me this, then it has to be done that way. One, ask questions. Why do you think the flu shot's important? I get it because I have to at work. I don't have I don't have patient autonomy at work because, however, as a patient, you do. You have, you can absolutely refuse, and they can explain the risk and the benefits, and then that's your choice.
Thank you so much, Dr. Horton, Valon, and Teanna. We've thoroughly enjoyed hearing your comments and also everyone that entered their questions and comments in the chat as well. And so I want to invite all three of you to be able to provide your contact information or your handles or your tags so that anyone in the audience that's interested in reaching out to you can go ahead and do that.
I'll put it down here. I'm on LinkedIn, so you can find me at Jodie, Jodie Horton, Horton. And I'm also on Instagram at Dr. Jodie, that's who. Yeah.
I'm on LinkedIn as Valon Alford, VALON ALFORD, and then on Facebook and Instagram at Vitality Wellness Solutions PLLC.
All right, and you can find me at, you can look on either postpartumwellness.com, I'm one of the therapists there, or postpartumwellness.org. That is the foundation that I work for as well. And then you can also contact me via Psychology Today. I'm also on LinkedIn. Both of those are Teanna Diggs. That is TEANNA. Diggs, DIGGS, because my name is not showing up at the bottom. But yes, you can find us at any of those.
Thank you.
Thank you.